Hi everyone, welcome back to my channel. Today I will be doing a nursing Q&A. Just a little bit about me. My name is Tyra and I'm a registered nurse. I've been a nurse for 3 years. Currently I work in the operating room, but as a new grad nurse, I started actually working in the ICU. So the first question is, how long did it take you to become a nurse? It took me 4 years to become a nurse. I did a bachelor's program at my school, which is a 4-year program. In nursing, there's multiple ways you can become a nurse. You can be an LPN, which is like a certificate to become a nurse. You can get your associate's degree, which is a 2-year degree, and then you take your boards and then become a registered nurse that way. Or you could do a 4-year program and get your bachelor's, and then you take your boards, which is what I did. Next question is, what degree do you have? I have a bachelor's degree in nursing. And the next question is, what is the difference between ICU and operating room nursing? So ICU nurses take care of the sickest patients that there is. I worked in a cardiac ICU where I recovered open heart surgery patients. A lot of them were either getting heart or lung transplants, or they had a heart attack, so they had to get stents put in their heart, etc. And in the operating room, I work in the outpatient OR, so these are surgeries that are non-emergent. So we do a lot of tonsillectomies or broken bones. There's pediatric surgeries, there's gynecology surgeries, a lot of orthopedic surgeries, and it's completely different from ICU nursing. In the OR, patients are getting surgery and they're not as sick in an outpatient setting. The next question is, what did you do in the ICU? So in the ICU, like I stated before, I took care of patients recovering from open heart surgery. And then what do I do in the operating room? So in the operating room, there's 2 roles in the OR. The first role is called circulating nurse, operating room nursing, and the second role in the operating room is called scrubbing. So as a circulating operating room nurse, I'm directly caring for the patient when they get into the operating room. I'm checking them in, asking them their name, their date of birth, what surgery they're getting, what their allergies are, and this is all part of the safety checklist before surgery. And I'm assisting anesthesia when they're putting the patient to sleep for surgery. And also I clean off the patient's skin right before the surgeon starts the surgery, and I am helping out during the surgery and opening supplies that they need during the procedure. And I also set up the operating room with equipment that they need for the surgery. And that's all part of the circulating role in the operating room. Whereas if I'm scrubbing in the operating room, I'm assisting the actual surgeon during the procedure, and I'm sterile in a gown and gloves and a mask. And out of the 2 roles, I actually enjoy scrubbing more because I actually get to see the surgery and help during that surgery. So the next question are, what are your hours? So when I worked in the ICU, I worked 3 12-hour shifts and I was on nights. Versus in outpatient operating room, I work 4 10-hour shifts. We start at 6:30 a.m. and our hours are till 5 p.m. Although, depending on when the surgeries end, we could leave either sooner or later than that time. And out of the 2, if I prefer 3 12s or 4 10s, I do like 4 10 hours. Especially in the outpatient setting, we don't work weekends or holidays. Whereas if you work in the hospital 3 12 hours, you do have to work weekends and holidays. So the next question is, how long was your orientation? So when I was in the ICU, my orientation, I believe, was about 3 months. And there was a lot that I had to cover. I had to learn all of the cardiac equipment, different medications, how to run a code. There was just a lot that I had to learn, and I had to learn advanced cardiac life support, which has to do with more codes in nursing. And in the outpatient operating room, my orientation was about 6 months. So with OR nursing, there's so many different surgeries that you have to learn, and you have to learn how to set them up. You have to learn the instruments that are used during the actual procedure, different patient positioning. There's just so much that goes into it. So my orientation in the operating room was actually longer than it was when I was in ICU. So the next question is, what is the hardest part of nursing? I would say by far, definitely COVID and the pandemic. A lot has changed in nursing, and different protocols that we have to follow with nursing. The next question is, how has nursing been in the pandemic? So for me, in the outpatient operating room, when COVID first started, we were only doing emergent surgeries, things that were more urgent. And a lot of the other surgeries like broken bones or tonsillectomies, those surgeries were canceled. And the new protocol that we had to do was swab each patient before their surgery for COVID. And if they were positive, they would be sent home and it would be canceled. I will say though, ICU nurses were hit probably the hardest out of all the nurses with COVID, because they are directly dealing with these patients and when they're at their sickest, whereas in the outpatient operating room, if the patient's positive, they're sent home and the exposure is not there. So the last question is, what do you enjoy most about nursing? What I enjoy most about nursing is being able to interact with patients. In the ICU, you're able to build rapport with the families and see patients at their sickest and help recover them. In the operating room, it's a little bit different because they are put to sleep pretty quickly, but you still get to interact with those patients when they're coming into the OR to the time that they're put to sleep, and you get to help calm down their nerves. So those are all of the questions for my nursing Q&A for today. Don't forget to like this video and subscribe, and let me know down in the comments if you want some more in-depth videos about OR versus ICU nursing. Thanks. See you.